Naur. I am from Neurosurgical Department in Bandung. I would like to present about distribution and characteristic of the neurospine patient in Neurosurgical Department at HASAN SADIKIN Hospital from 2012 until 2016. The background. As a medical referral center in West Java, HASAN SADIKIN General Hospital faces with the increasing amount of neurospine patients in various cases, and the need of an illustration and distribution map for the neurospine patient to support the system. We need for increasing medical service and medical care is a must. We try and still try to find the best solution to handle the neurospine patient fast, safe, and at the end we want to decrease the morbidity and mortality in HASAN SADIKIN Hospital. This is the method. The research were conducted by performing retrospective analysis of all the cases of the Spain patient who had come to emergency unit, outpatient unit, and the patient from other division that consulted to neurospine division at HASAN SADIKIN General Hospital between January 2012 until December 2016. This is the diagram from emergency outpatient unit and consulted from another patient to our department, the neurospine division, from 2012 until 2016. And we only have the raw nominal data. Okay, the result is in 5 years we have 384 patients with various of diagnosis, and in order to report it, we will try to divide it to several major disorders. This is the schema. The most common disorder are trauma with 147 patients, then followed by oncology, 100 patients, degenerative, 99 patients, infection is 31 patients, congenital 5 patients, and the vascular patient is the rarest. The patient of the vascular is 2 patients. This is the result. This is the characteristic of the trauma patient, the location of the lesion, and from the Asia impairment scale. In 5 years, we have 147 trauma patients, 111 is the male patient, and 36 female patient, and the most patients come from the productive age with high more mobility. This is the radiographical finding. We also find that the most common causes of the trauma mechanism is the motorcycle accident, not the car accident. Motorcycle accident is the first, followed by the fall and car accident, and also working accidental and assault. From the severity based on the Asia impairment scale, most trauma cases are scale A. We found in the 45 patients, and the most common location for the lesion is cervical, not the thoracic, cervical in 45 cases. And from 100 total patients, we found 108 patients with bone fracture. Most of all have the multi-level fracture, and 39 cases have the single level fracture, and 43 patients associated with the multiple trauma, like on the thorax or the abdomen trauma. This is the generative result for our patient. This is the characteristic. We divide it as usual, like sex, age, onset, the pain, and the visual analog scale. This is the location of the generative lesion. This is the clinical symptom. Result is in 5 years we have 99 degenerative patients, 66 male, and the most patient from age group age is more than 55 years old that we found in the 44 patient. And we also find that the patient is most come to our hospital with motoric and sensoric disturbance, is 45 patient, and only 8 patients have the vegetative disturbance, with the lumbar as the most degenerative location of our patient in 62 cases, and followed by cervical, and the pathology usually multi-level, not only single level. And we found most patients have onset of the degenerative result is more than 1 year, and also have the bilateral radiating pain, and visual analog scale is more than 4. And from radiographic finding, we have herniated disc is almost we found in all our degenerative patient, and listhesis we found also, but not too much, and ossification of posterior longitudinal ligament we only found in 10 patients. This is the oncology result of our patient. This is the characteristic, the location of the lesion, and this is the clinical symptom of our oncology patient. In 5 years, we have 100 oncology patients. 58 were female, the most. And this is the radiographical finding. This is the age is the most common is 40 until 55 group of age, and usually the tumor is intradural extramedular in 48 patients, and the thoracal is the most common tumor location in 49 patients, with the pathology also the multi-level. And from radiological finding, we found bone erosion in 41 cases, pathologic fracture in 11 cases, foraminal enlargement in 20 cases, dural tail in 19 cases, and syringomyelia in 10 cases. This is based on the clinical symptom, radical finding, and discussion and pathology result. We found that most cases in our NEUROSPINE division in Bandung, this is the meningioma in 24 patients. And for the metastatic tumor, we found that small cell lung carcinoma, or SCLC, tends to be the prone that invading spinal structure in 8 patients and followed by the breast cancer. This is for infection result, the characteristic, the location of the lesion, and the clinical symptom. In 5 years, we have 31 infection patients, 17 was male and 40 was female patient. And most patients from group age of 15 until 30, we found in the 11 patients with the onset is less than 6 months, and the thoracal found to be the common location of the infection with the multi-level pathology too, and the fracture we found in the 20 patients. And from clinical and radiological finding, we found that active lung TB in 40 patients, lymphadenopathy in 5 patients, gibbous in 11 patients, listhesis in 3 patients, and paravertebral abscess in almost all cases, that is 22 patients. And we have 2 patients with 1 infection or 1 dehiscence. This is congenital result, the characteristic. This is the congenital case. We have, in 5 years, we have only 5, 3 male and 2 female, and most patient count is from 15 until 30 years, with the craniovertebral junction is the most common location, and this is our distribution of the case of the patient of congenital. And this is the vascular result, the characteristic. We have 2 in 5 years that we still suspect with the spinal IVM and thoracal, but the patient is refused for the further examination and the treatment. The conclusion is we need to manage a good integrated database system to help management of the patient data, distribution, examination, and records. The distribution of the patient has been reported and can be useful to help for the future research for developing and improving medical service in order to decrease neurospine patient mortality and morbidity. I would like to thank you for the capacity of the man himself is only revealed when he is only under stress and responsibility. He will break through his educational shell, and he may then be a splendid surprise to himself, no less than to this teacher. This is thank you.